Now, even as the Republicans try to push a disastrous change to our healthcare system in the form of Obamacare repeal and replace, and of course with many establishment Democrats pushing to only save the ACA and not actually do anything better, it's important to note that our system, as it currently stands, what these establishment Democrats are fighting so hard to preserve, while better than pre-2010, isn't really all that great when it comes to the world. Now, in fact, according to a new analysis published on Friday by the Washington-based Commonwealth Fund, the U.S. healthcare system ranks among 11 advanced countries as last, dead last. Now, it ranks 11th among 11 countries in outcomes, in healthcare outcomes, access, equity, and efficiency. So those are the different metrics that they rank this on. So now that's what the system we currently have. Okay, this is nothing of what the Republicans want to do with it. The Obamacare replacement actually plan promises to make it worse, with lack of protections for pre-existing conditions, huge cuts in Medicaid, defunding Planned Parenthood, which helps millions of not just women, but men as well, and potentially causes millions of people to die. I'm sorry, not millions, so thousands of people to die without health care because they can't afford that health care. Millions, no, that's how many people will lose their health insurance, 22 million, but thousands of people will die a year from lack of access to affordable health care. So now let's get into the details of the study. Now, according to this study, the U.S. fell short in almost every domain measured. The Commonwealth Fund Senior Vice President for Policy and Research, Eric Schneider, told The New Scientist. Now, the study examines the healthcare systems of the U.S., the United Kingdom, France, Sweden, and several other nations, utilizing surveys of physicians and patients as well as data accumulated by the World Health Organization and the Organization for Economic Cooperation and Development. Now, the conclusion comes to one what we already knew about. The fact that despite spending far more money on healthcare than other advanced countries, the U.S. lags behind in categories from infant mortality rate to overall life expectancy. So think about that. We're the wealthiest country in the world, and yet we're behind these other countries in infant mortality. Disaster. So here's how they summarize the system. Quote, the United States spends far more on healthcare than other high-income countries, with spending levels that rose continuously over the past 3 decades. Yet the U.S. population has poorer health than the other countries. Life expectancy, after improving for several decades, worsened in recent years for some populations. Now, that includes white people, which are white rural Americans. Now, that's aggravated, of course, by the massive opioid crisis. In addition, as the baby boom population ages, more people in the U.S. and all over the world are now living with age-related disabilities and chronic disease, placing pressure on healthcare systems to respond. So that's their summary. Now, they said that timely and accessible healthcare could mitigate many of these challenges, but the U.S. healthcare system falls short, failing to deliver indicated services reliably to everybody who could benefit. So why is that? Well, it has to come down to comes down to money. They added that opposed to nations that guarantee healthcare to all, Americans' ability to attain quality healthcare is almost entirely dependent on financial status. So they said that your level of income defines the healthcare you receive far more in the United States than other wealthy nations. And unfortunately, that is incredibly true. If you are not a wealthy person, then you are not getting the best healthcare in the world. Which, like, everybody likes to say, oh, we have the best healthcare in the world. We got the best doctors. We got the best medicine. We got the best hospitals, most advanced. Okay, but unless you're a very wealthy person, you're not going to be able to take advantage of that. You don't have the ability to take advantage of that because you don't have the money. It's a crazy system. And it should be, I mean, it basically is the worst healthcare system out of the old advanced nations. And yet we, right now, don't do anything about it. Now, while acknowledging that the Affordable Care Act had much success in providing coverage to low-income Americans, particularly through the law's expansion of Medicaid, the Commonwealth Fund President David Blumenthal said that the U.S. healthcare system is, quote, still not working as well as it could for most Americans, and it works especially poorly for those with middle or lower incomes. Underscoring this point, the Commonwealth Fund's analysis noted that in the U.S., 44% of lower income and 26% of higher income people reported financial barriers to care. Now, think about that. If you're a middle-class person, and this is what I think a lot of people miss in this healthcare debate, is that people in the middle income, that they don't necessarily get subsidies, right, through the ACA. But they still have insurance plans that have high deductibles and copays. So if you have a high deductible, your insurance doesn't cover it until you pay that deductible. Well, that could be $10,000 or $20,000. That can be a very, very expensive deductible that you have to pay before you even get to use your health insurance. Now, even middle class people look at that and go, shit, man, I can't afford that. I just better not get hurt because I can't even use my insurance. And now I've got to pay a lot of money since I don't get subsidies for this insurance that I can't even use. So I can understand why there is a lot of middle class people who are very, very angry with the ACA's changes. Totally. And of course, that's why I'm in favor of a better system. Now, we compare this, that 44% of lower income and 26% of higher income people that have these financial barriers. Okay. Now we compare that to the UK, where they have a NHS, the National Health Service. Those percentages are 7 and 4%. Not even 10%. Whereas in America, almost half of all lower income people have barriers to healthcare, and around a quarter of middle class people have a barrier to healthcare. That's insane. A higher earning person in the US is more likely to meet cost barriers than a low income person in the UK. Look, there's a reason that all these countries, that the UK, Norway and Australia, have universal healthcare systems. Okay, there's a reason. It works. It actually works, and it's actually popular because it works. It's not just popular. Look, it wouldn't be popular if it worked like crap. It's popular because it works, because everybody gets care. Okay. Now, it's not without financial costs and challenges. Right. I mean, the UK right now is facing its own challenge with the NHS. But people in those countries, they look at our healthcare system, and even with the problems of their own, they look at ours and go, those Americans are barbaric. They're barbarians. They don't even allow a lot of their population to have healthcare, to have health insurance. That's crazy. And it's based on how much money you have. Barbarians. And that's the truth of it. And while Blumenthal concludes that while there are substantial and urgent problems with the healthcare status quo, i.e. Obamacare, Republicans' legislative efforts would certainly exacerbate these challenges, as millions would lose access to health insurance and affordable healthcare. So, there's the problem. What's the solution? Well, we already know. And the authors of the study already know. They observed that the U.S. healthcare system is unique in several respects. Most striking is the only high-income country lacking universal health insurance coverage. Well, I know how to get there. It's called Medicare. Now, what you do is you just expand Medicare to everybody. First, I think allow people to buy in. That would alone would rock the insurance market. It would force prices down, as they would have to actually compete with the government. And as more and more people buy in over time, you can phase out things like the subsidies for the ACA, tax breaks to insurance companies, and give the government more power to negotiate drug prices as well as other costs so they can bring down those costs. And that's not the only way that to transfer over to a single-payer system. There are other ways. The point is, insurance companies don't actually have to be part of healthcare. And that's where we've messed up. We put a for-profit model inside of our health system. That's essentially made healthcare not only a luxury for the privileged few, but also something that people are unable to get. Healthcare. Okay? Look, it should be a right. It's not a commodity to be bought and sold. It should be a right that everybody should pitch in with their taxes to pay for. Now, the fight shouldn't be whether or not to save Obamacare. It should actually be about, and thankfully some people are starting to get the message, should be about finally expanding healthcare to everyone, regardless of their means. That should be the goal. Hey everybody, thanks for watching this video. If you want to see more like this, please hit the subscribe button below. And if you want to support truly independent progressive media, please consider becoming a patron at patreon.com/TYTNation.